Hello and welcome back to another lecture from ophthalmology. And today we are going to study about a disease that is known as Dacrocystitis. So what is Dacrocystitis? Dacrocystitis is defined as the inflammation of lacrimal sacs. Now, before you have to know about Dacrocystitis, you have to know about this thing that is known as lacrimal sac. So if you understand the lacrimal sac, you will understand about Dacrocystitis. So first thing first, I will draw a diagram, and from that diagram, you will have an idea about what is lacrimal sac. Okay, so I'm going to draw an eye. This is your, suppose this is your beautiful eye. Okay, I'm sorry, not so good. Let me do another one. Suppose this is your eye. Okay, this is your iris. This is your pupil, suppose. Okay, now do you know that why are your eyes always moist? Why are they always wet? Because there is this gland that is known as lacrimal gland, which is present in the eyelids, and that gland produces tears. Okay, along with combination of other glands, it produces tears. So this gland produces tears and secretes it in the eyes to keep the eyes moist. Okay, now once they are secreted in the eyes, the tears have to be drained also. So you have to know about the drainage system. So this is how it is secreted, and now I will draw a system that will be known as lacrimal drainage system. Okay, so I will draw the drainage system, that how tears are drained out of the eyes. So first thing first, suppose this is it is actually like a pipeline. Okay, it is just like a pipeline, and there will be pipes that will drain the tears out of the eyes, just like I will show you now. Okay, suppose. Okay, so these pipes are known as caniculi. Okay, there are actually two caniculi. The one is superior and the one is inferior caniculi. So both of these caniculi drains the tears from the eyes into this place that is known as lacrimal sac. Okay, this is the thing which is known as lacrimal sac. Okay, lacrimal sac. So this is the thing which we will be talking about today. So lacrimal sac. Okay, now once these tears are drained into the lacrimal sac here, okay, these tears are then drained out by the duct. Okay, and this duct is known as nasolacrimal duct. Okay, what? Nasolacrimal duct. This is known as nasolacrimal duct. So with the help of this duct, these tears are then drained from the lacrimal sac to the inside of the nose. Okay, and this is all this thing which we have to learn about the lacrimal sac. Okay, so in between this thing, you have to know one more thing, that is the location of your nose. Okay, so where is your nose located? Your nose is actually just like this. Okay, it runs down like this. Okay, so actually this is your nose and this is your nasolacrimal duct, and it drains into the nose. Okay, so coming back to our lecture, we were discussing about Dacrocystitis. So what is dacrocystitis? Dacrocystitis is the inflammation of lacrimal sac. Dacrocystitis is the inflammation of this portion, okay, this portion. So what causes this dacrocystitis? There are a number of causes, but depending upon the causes, there are actually two types of dacrocystitis. The one is acute dacrocystitis, which is usually caused by the nasolacrimal duct blockage. Okay, suppose, and the other one is chronic dacrocystitis, okay, which is caused by infection. So first, nasolacrimal duct blockage, which causes the acute dacrocystitis. Suppose there is some blockage here in the nasolacrimal duct and the tears cannot come down. So when the tears does not come down, it will stay here, okay? All of these tears will stay here, and when they stay here, they will cause inflammation of this portion, and that inflammation will be known as acute dacrocystitis. Okay, so nasolacrimal duct blockage can also will lead to dacrocystitis. This is one cause of dacrocystitis. And suppose there are some viruses, bacteria, and they get into your lacrimal sac. So that can also cause infection. That will be known as bacterial dacrocystitis, or it can also lead to chronic dacrocystitis. Okay, so what are the famous, the most common bacteria which causes dacrocystitis? The most common are Streptococcus pneumonia, Streptococcus aureus, and pneumococcus. These are the bacteria that are very famous and common for causing dacrocystitis. Okay, so after the causes, we have to learn about the complaints of dacrocystitis. Okay, so whenever a patient arrives into your office and complains about redness in the medial side, okay, just like this, there will be redness here. There will be redness in the part which I drawn you in the diagram. Okay, this is lacrimal sac, and in this picture you can see that the lacrimal sac are just present here. Okay, so the patient will have swelling over here. Okay, this is known as, this is where lacrimal sacs are present. Okay, so that will have swelling in the medial. Okay, there will be swelling, there will be redness, there will be pain, and inflammatory signs will be present here. Okay, and there will be some kind of discharge. The patient will complain about discharge. Patient will say that I have some fluid going out of the eyes. Okay, so if there is a watery discharge from his eyes, you can confirm that this infection, this dacrocystitis is acute dacrocystitis. Okay, you can say that if the discharge is watery, it will be acute dacrocystitis. But if the discharge is mucopurulent discharge, okay, if the discharge is mucopurulent discharge, white pus color discharge, it means that the inflammation is not acute, it is actually a chronic dacrocystitis. Okay, it is actually chronic dacrocystitis. So this is how it will look. Okay, this is a picture of acute dacrocystitis, and if it is chronic, he will have pus coming out of here. Okay, so if this chronic dacrocystitis is not treated, it can lead to abscess formation. Okay, abscess is a very bad condition, very much very big amount of pus collection is known as abscess. So if this is not treated, it can lead to abscess, and it can lead to tenderness of all this area. Okay, so it is a bad condition. The patient will have all of these complaints when he arrives in the doctor's office, and then you have to make your diagnosis. Okay, so how will you make your diagnosis? The diagnosis is usually done by the clinical examination. The doctor has to look in the eyes of the patient. He can take help from instruments, but usually the diagnosis is confirmed just by taking a look. You will see redness here, so you can confirm it that there will be lacrimal duct inflammation. Okay, so you can make your diagnosis by doing clinical examination. You can also do swab or culture. Okay, you can do the swab or culture from the tears. There will be tears and discharge, so you can take a sample, just like doing the PCR test. You can take the sample and you can go to the laboratory and you can confirm that the presence of any bacteria or pathogen. Okay, so that will lead to the diagnosis. Once the diagnosis is confirmed, you will do the treatment. Okay, so how will you treat dacrocystitis? Usually acute dacrocystitis, it is usually treated with minor antibiotics and supportive treatment. Okay, usually does not need any much intervention, but still you can use antibiotic. Okay, topical antibiotic like creams and ointments can also be used. You can also use oral systemic tablets also. And if there is pain in the eyes, you can take analgesics. If there is very much swelling and pus formation, you can take anti-inflammatory drugs like ibuprofen or NSAIDs. This can also help. And you can also do warm cloth compression. You can take a warm cloth and you can put it on your eyes and you can compress. You can give the warm compression, and that can lead to opening of your lacrimal duct. Okay, nasolacrimal duct, and that can treat your dacrocystitis. So all of these things are a part of conservative treatment. Okay, if the dacrocystitis does not treat with all of these things, then you have to do the surgical intervention. So what is surgical intervention? Surgical intervention is when you take the patient to the emergency to the operating room, and you open his nasolacrimal ducts. Okay, so you can do the DCR. Okay, and you can also do the incision drainage, and this can help the treating the dacrocystitis. Okay, you can do a cut and you can drain the pus out of it, and you can make the opening of the lacrimal duct open. Okay, so this was all from today's topic. We learned about dacrocystitis, we learned about lacrimal sacs position, and how does lacrimal sac blockage can cause dacrocystitis. This is a typical example of dacrocystitis. There are actually two types of dacrocystitis. The one is acute with watery discharge, and the one is chronic with mucopurulent discharge. And then there is diagnosis and there is treatment. Treatment is usually with antibiotics. Azithromycin can also do. Gentamicin can also be used, and neomycin can also be used. You can take analgesics, you can take anti-inflammatory drugs, you can apply warm compression, and you can do the surgical intervention also. Okay, so thank you very much for listening. Next lecture we will going to be going to learn about keratitis. So stay tuned, and thank you very much for listening.